Happy lunchtime and welcome to Bird News and Views. I'm your host, Don Burgess, and we are very pleased this afternoon to have Sarah Williamson, who is a clinical dietitian at King Edward. Welcome, Sarah.
Hi, Don. Good afternoon, and good afternoon, everybody who's watching.
Okay. Now, Sarah, why did you decide to become a dietitian?
So I decided to become a dietitian because I was actually quite sick as a child, so I spent quite a lot of time in and out of hospital. So over that time and in the years that followed, I became very interested in health, in how we can help prevent disease, and interested in helping people. So as I grew again a little bit older, I came to the realization that the one thing that we all have in common is nutrition. So all humans need adequate nutrition and fluids to survive. So I love a challenge and I love making a difference. I love food and I love people. So it led me in to study dietetics, and here I am today.
Now, you mentioned nutrition. So what's the difference between a dietitian and a nutritionist?
Good question. So registered dietitians are generally the best health professionals available worldwide to advise and treat clinical conditions using nutrition. So we are uniquely qualified and we only use nutrition evidence-based methods. In times like this, we've discovered that other nutrition experts sort of come out of the woodwork and fill the gaps we have in science with sort of convincing speculation. So being a registered dietitian, we work within a code of ethics, we work within a standards of practice. So the advice and the recommendations we give to people are of a high standard, they're evidence-based and they're safe. It's not uncommon worldwide that anybody can call themselves a nutritionist, but not everybody can call themselves a dietitian. So nutritionists are just as valuable in the local community for giving healthy eating advice, but nutritionists generally do not work in clinical settings like we do, and they shouldn't be giving out advice for specific medical or clinical conditions.
Okay, that's an interesting difference. So like all dietitians are nutritionists, but not all nutritionists are dietitians.
Absolutely. So I think I would just say dietitians are generally seen as the gold standard for receiving your diet and nutrition advice from. We go through a lot of university education and training to be dietitians, whereas unfortunately nowadays you can become a nutritionist by doing a quick 1-hour course online. So we encourage people just to make sure the person you go to for your nutrition advice is appropriately qualified.
Okay. Now, how long have you been at King Edward, and how has your job evolved over the years?
So I have been lucky enough to call Bermuda my home for 5 years. I've worked in King Edward for 3 of those years. Prior to that, I worked in the community. So when I first started working in King Edward, I predominantly seen a lot of surgical patients with sort of gastrointestinal disorders. I work on the stroke ward. And then now, as sort of the COVID pandemic has evolved, I do work predominantly on the main COVID ward. So it has evolved quite a lot over the 3 years. I've been very lucky to get a lot of experience.
Right. What are some of the biggest challenges you are facing with patients who have COVID?
Some of the biggest challenges that I face with patients with COVID that I care for, the main one would be probably the psychological impact that COVID-19 and a COVID-19 diagnosis has on patients. If patients with COVID-19 end up in the hospital, it can be a very anxious time for the patients, and it's very isolating, especially because you are isolated. And at the moment, there's no visitors allowed in the hospital, whereas prior to the pandemic, and normally when numbers are low, visitors are allowed in. So it's very lonely for COVID patients in the hospital. It's very isolating, and I think my biggest challenge would be worrying about that psychological impact on them. My second biggest challenge would be actually communicating with those patients. And when I say that, in normal times pre-pandemic, we would openly be in and out of everybody's rooms. You would see our big smiles, good morning, good afternoon. You would see my eyes light up. I could talk to you, take time, sit beside you, hold your hand. Whereas now, I and other dietitians and other professionals in the hospital, we're gowned up in PPE. We often have multiple masks on. We have a visor on, we have goggles, mask, and apron, so you can't see our faces, you can't see our smiles. And I find that very difficult sometimes in talking to patients, because I can only imagine how that patient feels having someone dressed up like that constantly coming in and out to them.
Right. Now, how's that a little bit different than from when the pandemic started in April of last year?
So April of last year, a lot different. So I would say at the start of the pandemic, we were very nervous. It was a new disease. It was a global pandemic. I've never worked in a hospital during a pandemic before, and I think I could say the same for most of my colleagues that I work with. So it was a very nervous time. We had to do a lot of planning. We had to make sure our policies were up to date. We had to order enough feeding supplies, which I'll probably touch on later on. We had to do a lot of learning and educate ourselves about COVID-19 and the recommendations and guidelines that were starting to be developed. So we had to work quite quickly to talk to other dietitians, both on the island and internationally. We all communicated to make sure everyone was on the same page and we were all using the right evidence and recommendations. I would say fast forward to now, we're a lot more settled. I'm confident in what we're doing. We've had 4 waves in the hospital in Bermuda. So by now, we know our recommendations, we know what our role is, and we're very much used to it. So now I think my biggest challenge would be educating patients and teaching them what is the correct information against the misinformation, specifically regarding diet and nutrition. Last year, nobody really knew what questions to ask, and similar to us, we didn't really know what COVID was about to send our way. And now fast forward a year and a half later, there's plenty of information out there. So we get asked a lot of questions today compared to last April, and it's just making sure we can educate everybody appropriately and put them in the right direction.
Yeah. So what sort of questions do the patients ask you?
We would get asked a lot about, quite simply, is there a certain food I should be eating more of? Is there a certain food I should be eating less of? Does this vitamin help me? If I supplement with this vitamin, can it help me? So straight up questions that we all read about in social media, in the media, in WhatsApp groups. I'll get asked those questions, so I have to have the answer on the tip of my tongue. So it's really important I try to stay up to date with all the latest recommendations, evidence, but also the latest myths and legends that are out there in comment sections and in the media. I also get asked questions genuinely if someone is really unwell in the hospital about what they can do to help themselves once they leave hospital. Because as I'm sure you know, Dawn, your taste can change, your smell can change. If you are in hospital, one of the challenges is actually if your nutritional needs are not met, it's not uncommon that you lose a lot of muscle mass, and your physical and sort of your ability, your functional ability can decrease. So people want the advice and the answers to questions on how to make them stronger for home and what they can do once they get home as well.
Now, is there any sort of, I know like Bermuda has a high incidence of diabetes. How would somebody who's diabetic in the hospital with COVID maybe differ than somebody who's got some sort of heart disease or heart problems in finding the right diet for them?
Yeah, a good question. So I think it's important to remember that pre-pandemic, and just to highlight this, 75% of Bermuda's population were overweight or obese. And we think at the moment, and I've consulted in my specialist diabetes dietitians colleagues, that 13% of the population at the moment have type 2 diabetes. So although 13 doesn't sound like a big number, it actually is. And we are number 2 behind the US in our region for obesity and type 2 diabetes, and that's a really serious statistic. So in hospital, generally speaking, if you have diabetes, you are more vulnerable to developing severe symptoms of COVID. If you have uncontrolled diabetes, so those that are diabetic will know if their HbA1c, without getting too scientific, is elevated, or perhaps they've had previous diabetic complications. Being ill can actually make your blood sugars go all over the place, and your body will work overtime. Generally, when you're ill, your body is working overtime to get better, making it harder to manage those blood sugars. So we run into various complications. Evidence generally does show that being a healthy weight, having well-controlled diabetes, for example, does improve your health outcomes, especially with COVID-19. And I think it's important just to note that those that are obese or overweight or have diabetes, you are more likely to be hospitalized and you are more likely to be admitted to the ICU with severe symptoms. So I think it's important to highlight the importance of staying on top of our health. And if we do have comorbidities, just trying to keep on top of them.
Right. The number of obese people in Bermuda seems really, really high. I didn't realize it was, I think you said 75%?
Yes, so I'm getting that from our 2014 Steps to Well Bermuda survey, so it's worth looking up. I believe there was maybe supposed to be one done in 2020, but obviously we got distracted with the pandemic, so I don't have a more up-to-date statistic. But I don't anticipate that's changed that much. And yeah, it is. It's a scary reality.
Right. With obesity being one of the abilities for COVID, I guess we all could use to slim down a little bit at least.
I mean, yeah, absolutely. So, like I said, the evidence says if you do have a healthy weight, if you are a healthy weight, you're probably less likely to suffer from those severe COVID-19 symptoms. So, yeah.
Now, patients who've lost their taste and smell, how does that affect your meal planning for them? We had Dr. Francione and Dr. Fountain on last week, and I think it was Dr. Francione who said the food tastes like blank because of the loss of taste and smell. What have you seen for people, and how do you help meet that? I know, like, there's always that running joke that hospital food tastes bad anyway, but with COVID and not being able to taste and smell, I'm sure like people are not very happy with that.
Yeah, absolutely. So I'll just talk specifically about in hospital and how I help patients. So I mean, my first thing would be just remember if you're in hospital, you will be served hospital food and you won't be served lobster. But the main things that patients do report to me, it is quite interesting. Some patients with COVID-19 will report that everything tastes like metal. They'll have a really, really severe metallic taste no matter what they eat or drink. Other patients have reported a really, really sweet taste in their mouth. Now, I do like sweet foods in moderation, but like an unbearable sweet taste, so nothing tastes nice. And other patients have actually reported foods tasting really bitter or salty. So it seems to be a big, broad spectrum of how your food can end up tasting. I think what's important to point out is our taste buds do regenerate. So hopefully that doesn't stay with that patient forever. But from what I've heard and from speaking with patients, it's not a pleasant experience to go through whilst it's there. And I don't have a quick fix for it or advice for people that do go through taste changes specifically. We do have some practical ideas we can try with the patients, and hopefully a light bulb goes off and something works. So, for example, a funny one that people always laugh at and might apply at home, if you have a metallic taste in your mouth, it can help to actually use plastic cutlery. So thankfully, plastic cutlery can help with getting rid of that metallic taste. And sweet foods, you could actually eat more acidic foods to counteract that. There's a few tricks that we can suggest to patients and play with their food and add different spices and condiments. But it is a challenge, I will be honest, and I'm sure the patients find it just as challenging.
Now, we have a reader question from Stephen Upton. He said he read your article the other week and thought it was very informative. A friend thought that taking big doses of supplements can help with the symptoms. Is this true?
That's a really good question. Thanks, Stephen, for your feedback. So no, I would say no, it's not true. So taking big doses of supplements can actually be dangerous, and often bigger doses of anything can actually do more harm than good. So I have two really good examples, so I'll inform you of them. So vitamin C is quite popular. I get asked a lot about vitamin C and high doses of vitamin C supplements and infusions of vitamin C by family, by friends, by colleagues, by patients, everybody. And I read about vitamin C everywhere. So vitamin C, it is an antioxidant, and we actually do need it for like wound healing and our skin. There's a little bit of evidence that vitamin C can decrease the severity and duration of a cold, the common cold, but only if you are already deficient. And to be honest, most people are not deficient in vitamin C. So only supplement in vitamin C if you are already deficient. There is a big study still going on in China looking at high dose supplementation via IV. However, those results have not been published, and as recent as this morning, I just wanted to make sure they haven't been published so I didn't catch myself out, and their results are not available yet. So with regards to high dose vitamin C, for example, there's absolutely no evidence that can help with COVID-19, and it can be dangerous because excess vitamin C can lead to actual flu-like symptoms like nausea, cramps, diarrhea. It can also lead to kidney stones, all of which are equally unpleasant. And if you're active, and I know we have a big triathlete community in Bermuda, if you're active and you take a lot of vitamin C via supplement, for example, it can decrease muscle recovery, which I'm sure is also not that pleasant. The recommendations for vitamin C, just for reference, generally men should take about 90 micrograms a day of vitamin C, women 75 micrograms, but you can get that from eating plenty of fruits and vegetables. And any excess vitamin C you take over those numbers, you actually excrete it in your urine. So I know how expensive supplements are in Bermuda, and that is very expensive pee. Another one would be vitamin D, and it's quite popular, and taken in excess amounts can be very dangerous to us. So we do need vitamin D for our bones, muscles, and our teeth. There's another little bit of small evidence that vitamin D may have a role in the immune response for respiratory viruses. But again, it's only a little bit of evidence at the moment available for using vitamin D to support or treat COVID. So there's not enough evidence there just yet. However, health professionals, dietitians, doctors, generally because there's such a good link to bone and muscle health, and people are usually deficient in vitamin D, that's probably one of the only supplements we would commonly recommend everybody should supplement with. And the recommendation is 10 micrograms a day. Any more than 25 micrograms a day can actually lead to weaker bones and kidney and heart problems. And I don't want anyone having kidney and heart problems on top of any other problems like COVID-19. So things can happen if you overdo it with any vitamin. Excess is almost never a good thing. So I would really encourage people to stick to the recommendations and don't overdo it, because I don't want to see anyone running into other problems. Generally speaking, if you eat a healthy, balanced diet, which I'll probably touch on, you can get everything you need.
Right. So what would be a healthy, balanced diet? I know a lot of people are recommending eating certain foods as to help against COVID, but in general, what would you say people should be eating?
So in general, or simply put, there is not one specific food or supplement or vitamin you should be eating more than another. There's little evidence to support a particular way of eating for the prevention of COVID-19. It is a respiratory disease and we can pass it from one person to another. However, to support your immune system, so hopefully you don't suffer from severe symptoms or side effects of COVID-19, eating a healthy, balanced diet, which is rich in plant-based foods like fruits, vegetables, whole grains, nuts and seeds, with some oily fish, healthy fats like olive oil, and keeping our processed foods like our cakes, our cookies, our pies, our chips, and refined carbohydrates to a minimum is probably a good place to start. That way you are probably going to get enough vitamin A, B, C, D, enough folate, enough omega-3, enough iron, zinc, selenium, and copper, all of which are all important in supporting our immune system.
You mentioned vitamin C and D, but what would you say would be the biggest food myth outside of those two?
The biggest food myth, I don't know if it's a food myth, but the biggest myth out there is that you can boost your immune system. So you cannot boost your immune system. You've already heard me use the word support. You can only support your immune system with diet. And to boost your immune system would be a disaster. If you boost your immune system, essentially, you're given rise, for example, autoimmune diseases are an example of overactive immune systems, like lupus or rheumatoid arthritis. You don't want to boost your immune system, you just want to support it. So I think the biggest myth would be that you can boost your immune system. You cannot. If someone tells you to boost your immune system, I know people laugh at me because I tell everybody you should honestly run in the other direction. You can't boost your immune system, you can only support it. And by eating that healthy, balanced diet, by being physically active, you can do just that.
Now, during this last wave, you've had to deal with 50 or 60 people in the COVID ward upstairs.
Mm-hmm.
What is that like? How is that affecting you and the nurses and the other support staff, seeing that many people sick with one disease?
So when we have experienced an increase in COVID-19 patients in the hospital on top of other patients, it does require a lot of planning, but that is what we're here for, and we are used to that. I think at times it can get a little bit stressful because there's only so much time in the day and we have to go home at some stage. So there's only so much we can do for people in a day. So I know we welcome a fresh start the next day. I think the main thing would be it can be very intense, and even talking to all my colleagues, doctors, nurses, our physiotherapists, occupational therapists, speech therapists that we work with, everybody probably finds it quite intense when the numbers are high. But we are used to it, and that is what we're here to do. It's our job. So with a little bit of planning, it's okay.
Right. Now, I know you're not down in the ICU ward, but I know you've talked with your colleague, Chloe, down there. For patients who are intubated, what sort of challenges are there to make sure that they get their nutritional needs?
So yes, I spoke with Chloe this morning. So at the moment, Chloe is our ICU dietitian, and I'm up on the main COVID ward. So we both actually had time to catch up this morning because it's been so busy we haven't had a chance. We both did agree. Working in the ICU and seeing intubated patients, it's actually very sad. It's very intense because that's literally almost all that they've seen recently. We do work closely with the doctors and nurses, and we can see, and Chloe will say, everyone is tired and can get quite fatigued. The main thing Chloe said, and I know I've spoken with doctors and nurses that we work with as well, it can be quite emotional for everybody working down in the ICU. I know that we all get used to caring and treating patients, so if those patients end up not doing too well, it can be very sad. Especially, like I mentioned before, relatives and visitors aren't often allowed in at the moment to see the patients. And I think I'll just speak on Chloe and I's behalf. It's very tragic that it's come to this, and it's just generally a very sad area to work in.
Mm-hmm. Yeah, how is the staff and you and yourself and Chloe, of course, dealing with this large amount of death that you're having to deal with on a daily basis down at the hospital?
I don't know if I'm the right person to answer that question, because as a dietitian, we sort of scoot about everywhere within our area and do our thing. Like I said, all I do is talk about food all day. And so I think that might be a better question to ask the nurses and the doctors or those in ICU at the moment. I do know, speaking just from myself, when numbers and deaths do increase, again, it's extremely sad because we do care for those patients and we get used to seeing them every day and making sure they're okay. So like any disease, but particularly obviously COVID-19 at the moment, if any patient deteriorates or passes away, it's very sad. And if there's a lot of that and you're hearing and talking about that every day over a span of hours, it can be very emotional for staff.
Well, 30 minutes has gone flying by. Just wanted to give you a chance to have some last words or something you want to get out to the community that you think is important that maybe I haven't asked you at this point.
Yeah, I know that did go fast. I think the main message I just want to tell everybody is I would encourage outside of the hospital, if you don't have COVID-19 or if you are at home with COVID-19 or if you're in hospital with COVID-19, with regards to diet and food, I would really encourage people to challenge claims about certain foods or vitamins helping COVID-19. It's a very slippery slope, reading a lot of misinformation online, and before we know it, we're rejecting normal medicine for food. But it's really important to remember that food is not more superior to medicine in the case of COVID-19. The word natural sounds logical and natural food does sound believable, but natural immunity using diet and food will not protect you or treat you from COVID-19. There's honestly not one food that can do that. A good diet can slightly reduce your risk of those severe symptoms, but in the case of COVID-19, honestly, vaccination, and I've seen firsthand, is your best chance of keeping each other safe and keeping yourself safe. I would just say your overall dietary pattern is always going to win over individual foods. So I would just emphasize the vitamin D supplementation of 10 micrograms a day, following that Mediterranean style diet, plenty of information online, and staying physically active. And if you do feel you need that support or guidance or that one-on-one time with somebody to talk about those things, ask your GP or look us up and go and see your registered dietitian. And I think the most important thing would be if someone tells you to boost your immune system, you should run.
All right. We want to thank Sarah Williamson, who's the clinical dietitian at the King Edward Hospital, for being with us today. Sarah, thank you.
Thank you. Thank you very much for having me.
I can see from the comments from on the side there, Christina Hart just put one up, and Jim Ramsey as well. Just thanking you. There were more in front of them, so the audience has found it inspiring and useful. So appreciate you being with us here today.
Dawn, can I add one more thing? Just
sure.
Naughty. I am aware that people like access to research and the papers and stuff that maybe I have access to. I should have mentioned this earlier. There's one amazing study. Basically, there was a study done between King's College London and Harvard Medical School, and a collection of registered dietitians, doctors, and health professionals surveyed 600,000 people during, before, and after they had COVID. And basically, they surveyed them on their diet, their lifestyle, and the outcome and the recommendations from that was following the Mediterranean diet, the vitamin D supplement, and staying active. So I think my point is 600,000 people that were surveyed, that's a big sample to put into research. So it's very worth looking that up. And that study was called the ZOE, Z-O-E, COVID study. And it's easy to follow, and the recommendations are all there.
Z-O-E COVID study.
The ZOE COVID study.
Okay, great. All right, thank you again. For those who've been listening, I've been your host, Don Burgess, and always on behalf of Burn News, wishing you a beautiful afternoon.